Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
If your child has a high fever or other flu-like symptoms, you might feel anxious as a parent. And you might be left wondering whether your child has a cold all the time or is suffering from the dreaded pneumonia. One of the most common causes of death in children worldwide, pneumonia is responsible for 14% of all fatalities in children under the age of 5. Pneumonia affects children and families all over the world, but the highest rates of death are in Southern Asia and Sub-Saharan Africa. This could be due to the fact that pediatric pneumonia is frequently undertreated or ignored. As a result, pneumonia education for parents becomes essential. Hello everyone, I'm Dr. Samya Saluja from Tip Media, and today we'll discuss pneumonia in children with Dr. Sourojit Gupta, who will help us understand this potentially fatal condition. Dr. Sourojit Gupta has been in practice for more than 12 years and has extensive experience in the field of pediatrics and neonatology. Dr. Sourojit is associated with prestigious hospitals like VPS Rockland, Bensups, Bhagat Chandra, and Akash Healthcare in Dwarka. He was recently heading the Care Newborn and Child Hospital in Gurugram, where he managed numerous premature, ill, and ventilated newborns. Sir is a specialist in pediatric nutrition as well as newborn care, adolescent medicine, asthma management, pediatric intensive care using safe vaccination techniques, and neonatology. He has done a fellowship in neonatology at Bhagat Chandra Hospital under Fortis, Laufen. Currently, he is a practicing pediatrician and neonatologist at Mata Roop Rani Maggo Hospital, Uttam Nagar. Dr. Sourojit, Fit Media welcomes you, sir.
Thank you.
Sir, as you are aware that pneumonia in children could be fatal. So to start this conversation, I'd like to ask, what exactly is pneumonia and what are its main causes?
So pneumonia, it's a form of respiratory infection. It usually affects the lungs. It does affect the lungs. And since the lungs, they are filled with air spaces, the alveoli, they are small pockets of air that are usual in normal human being. It's present in like as a air pocket. It gets filled with pus or it gets filled with fluid, and making it difficult and painful for the children or any human being to actually breathe through it. So that is that fluid or the pus is actually the infection, the pneumonia that actually causes, and it makes the child or the patient difficult to breathe, difficult to maintain the oxygen limits, and that is when the fever sets in, because the WBCs, they take over, they act as a soldier in our body. So they take over, and then fever comes in, and the child tries to maintain the saturations and maintain a proper like breathing pattern, but he's not able to. So this causes pneumonia, this causes high grade fever, this causes breathing difficulty and decrease in the saturation levels. The main causes are, it could be viral. The situation right now is mainly viral. It could be due to influenza, it could be due to COVID, it could be due to bacterial infections, it could be due to fungal infections. Sometimes in small babies, we see aspiration pneumonias, like when the babies are fed in the lying down positions by bottle, or even if the burping is not there. It might happen during a course of seizure when there is vomiting and the fluid or the gastric contents, they tend to get into the lungs and cause pneumonic patches. The main infective, the bacteria that they infect the lungs are strep pneumonia, H influenza type E, RSVs, HIV patients with pneumocystis jirovecii, viral are adenovirus, rhinovirus, and the influenza viruses. In the present scenario, if we talk, it's COVID mainly, The fungal infections that can also happen, but usually these the viral ones, they usually after a few days, like around 5 to 7 days, in this strain of COVID, we are not seeing that fatal ones,
Right.
which is a very good news, because yes, the babies are the smaller ones, the babies who are younger than 4 months, younger than 6 months, in fact, they are directly landing into the ICU, and after maybe a good oxygen support, a good like respiratory support for 48 to 72 hours, they are coming out, thankfully. And we in the last 1 week or so, we have been seeing the cases on a rise, mainly the ones with influenza and the ones with COVID, with a good amount of difficulty in breathing,
Mhm.
and that decreases, and somehow we come out of it, thankfully.
Okay. And as you just mentioned the word fever, that pneumonia is associated with high fever. So,
Yeah.
what differentiates pneumonia from a simple fever? I mean, how will parents understand this difference?
uh, Fever is like a response to any kind of infection.
Right.
Okay, so it's not bad to have fever. Fever is the response of our soldiers in the body, like the WBCs. They help in like the bacteria or the fungal infections that has happened.
Right.
The WBCs, they try to control that. They
Mhm.
try to kill the pathogens. So that causes fever. A very high grade fever does not mean that the child is very sick.
Okay.
Even low grade fever can be can be a clue to a sick infection. But high grade fevers usually are associated with viral pneumonias or viral fevers. The main way, the easiest way to differentiate between a viral and a bacterial thing is that when there is a viral infection, the period when there is no fever, like suppose there is a fever at 7 o'clock, you have given a medicine, the fever has come down by 8 o'clock, and then from 8 o'clock to maybe 12 o'clock or 1 o'clock, when there is no fever, the child is active. So that, if that is the scenario, then there is usually a viral infection,
Okay.
which usually settles down after some period of time. Whereas in bacterial, this normalization phase is usually not there, and the child is very sick.
Mhm.
The child is usually lying down, and maybe the child is not able to get up, not playful,
Mhm.
not active. So
Right.
that is how we differentiate between a bacterial and a viral infection clinically. Also, there are a few more things. If there is a contact history, the other members of the family are also infected with some sort of cough, cold, fever, or maybe running nose, maybe breathing difficulty, we have to consider that also. If there is a contact history with a tuberculosis patient in the house or nearby, then also we need to think about tubercular pneumonia or something sort of. But usually the babies who are younger than 6 months, we need to be very careful about them. We
Mhm.
need to see a few things like the lethargy part, which is very important with fever. If the baby is not taking feeds well, if the baby is not passing good amount of urine, then if there is dehydration along with fever, dull, of course, if even if we are sick at times, we will not be able to take 100% of the food that we usually take. So
Right.
even if the child takes around 70 to 80%, even 60-50% of food, we
Right.
should be okay. We should not be worried. But if there is respiratory difficulty, if there is like respiratory distress in the form of subcostal, intercostal, or suprasternal retractions, like you see the invaginations of the respiratory muscles,
Right.
and there is nasal flaring, there is grunting, you can definitely easily differentiate, especially the mother can easily differentiate between a normal child and a sick child. And you should always go by what the mother says. You
Okay.
should always trust the mother, the family, the person who is taking care, if the child is not well. So
Yeah.
that is the hint that usually we take from the caregivers as to how the child is. High grade fever is usually if the child is normal after the fever has come down. If the
Okay.
child is playful, you should not be worried about.
Okay.
You should wait for like 4 to 5 days, because
Right.
usually the viral fevers, they settle down after 4 to 5 days, and you
Mhm.
should not be worried about that. Yes, of course, if the child is not taking anything orally, if the child has not passed urine for more than 12 hours, if there
Right.
is breathing difficulty, if there is severe intercostal retractions, if there is like in Indian language, in Hindi language, what the patient say, chhati chal raha hai. So
Okay.
if there is something like that, then we need to evaluate the child, we need to admit the child, we need to give oxygen, we need to give other supplements, whatever is required at that point of time.
Right, sir. So, if a parent reaches out to a pediatrician, particularly for pneumonia, so what is a pediatrician's approach to treating pneumonia in children specifically?
So first of all, whenever a child comes to us with breathing difficulty, cough, every Indian parent or every Indian household, they are very much concerned about pneumonia.
Okay.
They will say many of ones are not so well literate. So they usually come up and they say that मेरे बच्चे को pneumonia बार बार हो जाता है. It
Acha.
is not that actually. It is not that.
Mhm.
It is not that every cough and cold, every flu is a pneumonia.
Right.
No, it can be a simple upper respiratory tract infection. It
Right.
usually is not. Pneumonia is a very grave situation. So we need to differentiate between an upper respiratory and a lower respiratory tract infection. If there is breathing difficulty, then it is something that has to be considered. Otherwise, if a child comes to us with high grade fever, with breathing difficulty, we first check the saturations. We
Right.
see if the child requires any oxygen. If there is after auscultation, if we see some wheeze, if we see some craps, if there is severe respiratory distress, we try to give nebulizations.
Right.
See, in India, nebulization, the medicines and all, they are easily available over the counter. So
Right.
over the counter nebulizations also should not be given. Antibiotics are like simple. It's like chocolates.
Okay.
Any person, I usually say this, tell this to my patient, that every person in India is a doctor.
Yes.
Every person is a doctor. Yes. And everyone will try to give antibiotics, which is the first thing that they usually give.
Right.
Augmentin, cefixime, cefpodoxime, sometimes even a very high antibiotic like colistin, that
Okay.
is given over the counter,
Right.
and they are taking it. So we
Right.
need to stop that,
Right.
because antibiotic resistance is one very difficult thing that we are seeing in near future.
Yes.
So there won't be any antibiotic left for us to treat the small innocent babies, right? So just the thing is that they do not want to show to a doctor. They want to trust the 10th pass or 8th pass person who is distributing the medicines at a medical store. They
Right.
trust them.
Right.
That is the sad situation. That is
Absolutely.
the very sad situation that we see day in and day out. Nebulization also, apart from normal saline nebulization, I don't think so. Without a prescription, without a doctor's consultation, nebulizations like the bronchodilators, the steroids should not never given.
Yes. Yes.
Yes, if a pediatrician or a doctor has seen and he feels like the nebulization has to be given, it has to be given.
Okay.
So what we see is, first of all, if there is respiratory distress a lot, we start with nebulizations. We start with levolins. We start like the salbutamols. We start with steroids.
Right.
We if the distress is very high, we often go with magnesium sulfate. We often go with steroids, and
Right.
then once the things settle down in a couple of days or so, we tend to decrease the nebulization part and the respiratory stimulant parts,
Okay.
respiratory depression parts. Then antibiotics do have a role, because if we are suspecting even any kind of maybe infection,
Right.
we should wait for the reports definitely, but culture takes around 5 days to come.
Okay.
So suspicion of an infection, we have to give broad spectrum antibiotics. That has to be there, but it should be given under supervision also.
Right.
And if the baby is maintaining good saturations, like of late, what I have seen in the couple of maybe days, maybe a few, like in a couple of weeks or so,
Right.
babies of 6 months to 4 months to 6 months, they are coming in very bad shapes.
Okay.
They are coming in severe respiratory distress with a lot of grunts, with lot of creps, wheezing, and after continuous nebulizations, they do come up. They need a good amount of chest physiotherapy also. And then when they start settling down, then they do become absolutely fine in no time. But we need to give that much time to the kids also.
Right.
So that's the thing. So our approach is always to maintain a proper respiratory, the respiratory distress should not be there. The respiratory difficulty should be minimized as much as possible.
Right.
By nebulizations, by steroids, by magnesium, so that the child becomes stable as soon as possible, and it is a visible good view for the parents also when
Right.
the child recovers a bit faster. So there is nothing known as quick relief to the to any patient. There is no magic wand that we have in our hand. It has to be stepwise. We need to understand.
Right. Okay. So now we all know that healthy children can fight off infections,
Yes.
but there are any factors that parents should be aware of, especially for pneumonia.
So first of all, if the child is a school-going child,
Right.
like um, the schools have reopened again. So after like 3 years or so, the children, they start going to school. So they are getting exposed to a lot of pathogens.
Right.
It is not bad. It is not bad that the child is getting exposed to so many pathogens. Should we send the child to school? Of course, you have to send the child to school.
Right.
Right. A small amount of upper respiratory infection, thoda sa cough, thoda sa running nose, doesn't matter. It's okay. Right. So in our childhood, maybe yours also, we never used to consider a small cough and cold or even fever to be that important that we should miss out on schools. Of
Right.
course, rest is important. So we need to hydrate and give rest to the children very often.
Right.
Should not overburden the children.
Mhm.
If we are going out to a like crowded places, we should be careful because the things are on a rise. Maybe influenza, maybe COVID, maybe it's something else that is changing the names and coming and disturbing us, our lifestyle now and then. So we have to be extra cautious about that. Yes, the smaller children, we should limit. See, whenever there is a new kid in the house, if there is a newborn baby, of course, we all are very much happy. We want to meet the baby. We want to congratulate the parents, but we need to follow a few things. We should not touch the baby without asking. We should wash our hands very nicely. If we have come up from outside, we should try to change our clothes first and then pick up the baby. We should not kiss the baby because these are the ways that usually transmits the infection, transmit even viral infections.
Right.
So that is.
Okay. And what should a parent do to keep their child safe from this disease?
A good nutrition is must.
Right.
So what I have been seeing is that most of the school children, when they go to school in the morning, they do not have proper breakfast.
Okay.
So breakfast is one very essential part of our body. Breakfast is the one that is skipped by the children very easily.
Right.
Because the school bus, even for my kid, the school bus, it comes at 7 o'clock in the morning.
Right.
So for a kid of 5-6 years, he makes a lot of effort to even get up, like at around 6 o'clock, 6:15. So that for 30 minutes you have to get up, you have to go to the washroom, you have to take a bath, you have to change your clothes, you have to have your milk. So it becomes way too much for the kid, and the child skips the breakfast. So
Yes.
that is how the child is going empty stomach, because the child has had the dinner at around 9-10 o'clock the previous night. So
Mhm.
it and the tiffin, the recess, that occurs at around 9:30 or so in the morning.
Right.
So more than 12 hours, the child is empty stomach,
Okay.
right? So with so big a time when the child is empty stomach, you are prone to infections. You are
Right.
very much prone to infections. You cannot stop, you cannot make a 3-year-old, a 4-year-old, a 5-year-old, even a 6-year-old wear mask whole time in this summer.
Yes.
You can obviously advise, but you cannot force, or you cannot, it doesn't happen.
Right.
And they will play with the other kids. There will be kids who are not so well. They might sneeze, they might cough. But
Right.
yes, what we can do is we can teach the children
Mhm.
as to, whenever you cough, whenever you sneeze, use your shoulders to sneeze on it,
Right.
and take a good breakfast,
Right.
drink lots of water, a good mineral, a good amount of protein
Right.
will help the children build up their immunity, will
Right.
help the fruits that will give the essential minerals and vitamins, micronutrients,
Right.
and lot of vegetables. Because if you are, even if you are a totally veg and you are taking full only good vegetables, but
Okay.
can you say that all the vegetables are not adulterated? You
Yes.
cannot. So at least 50%, like 70% of the vegetables are mixed up. So even if they are, if we take good amount of diet for these, because we should not, in fact, give medicines for everything.
Absolutely.
We get parents who are concerned about it, and they come to us and they say ki weight nahi बढ़ रहा hai, and please give me some multivitamins, some medicines to increase the appetite. There should not be any medicines to increase appetite. I never give any medicine to increase appetite.
That's great.
I always consider that the diet should be good. The
Right.
amount of small minerals, the vitamins, the proteins, these should be given in a good manner. No
Right.
commercial food should be given. The
Okay.
weaning part is very, very, very important. I
Right.
have mentioned a lot about the weaning in my channel, if you can see. So,
Mhm.
weaning is the most important part. You
Right.
should not give, you should try to give breast milk as much as possible. Breastfeeding gives you immunity. For all the new moms, this is one thing that you should always follow: breastfeeding, breastfeeding, breastfeeding till 6 months of age. Do
Right.
not give bottle feed. Do not try to go up to the cow's milk,
Right.
and cow's milk should not be given till 1 year of age.
Right.
After 6 months, because till 2 years, 2.5, 3 years, when the child is under your control, you
Right.
should try to
Right.
give as much minerals, as much food, and proper good things as possible.
Right.
Because after the light falls on the junk food, the pizza, the burger, the French fries,
Right.
then very difficult for them to. Because my son only, um, he tells me that if you give me fruits are
Right.
not good for a child.
Okay.
So I usually tell him ki fine, theek hai beta, you take my degree, you can tear it off and
Oh
throw
my
it away.
goodness. Right.
Because uh, this is how he likes all sorts of junk food. Like yes, he does have vegetables, but yes, junk foods are have become an integral part of the kid's life.
Of course, right. Yes.
So till from 6 months to 2 years, 2.5 years, give as much nutrition as possible,
Right.
as much vegetables as possible, as much till 1 year of age. Do not give any sugar and salt,
Right.
and try to give as much good food as possible. There
Right.
is nothing like a good nutrition in dal ka pani and chawal ka pani. There is nothing. It is just water and turmeric.
Okay.
There is no nutrition. So
Right.
if you want to give dal ka pani, give dal,
Instead.
right? Give good nutrition, which is more important, rather
Right.
than cutting down on them and relying more on the junk food or the biscuits. Yeah.
Right. Absolutely. So, Dr. Sourojit, we are grateful for your presence today. I'm hoping that this information will be useful to many families. Thank you so much, sir.
Thank you.
And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you so much once again, sir.